Question 1. A client with end-stage heart failure is bedridden, and the skin in the coccygeal area is red and tender despite frequent turning because the client is occasionally incontinent of urine. The client weighs 180 pounds. Which type of pressure relieving surface should the nurse most recommend at this time? Options are foam overlay, zip skin, alternating pressure overlay, or lower loss bed. The right answer is 3. Alternating pressure overlay. Question 2. A client is to receive 120 ml of normal saline per hour intravenously. The drop factor is 15 drops per ml. What drip rate should the nurse set in the drops per minute? Here is the solution. The problem can be calculated using dimensional analysis. 120 ml by 1 hour into 15 drops by 1 ml into 1 hour by 60 minutes, and you can get 30 drops per minute. Question 3. A client has weakness of both lower extremities, more pronounced on the right, and uses crutches to ambulate. Which of the following gaits requires the most upper body strength and balance? Options are 4-point, 3-point, 2-point, swing through. The right answer is 2, 3-point. Question 4. A client has just had a long leg cast applied to his leg and is in bed. The cast is still damp and the client is cold. Which of the following actions by the nurse are appropriate? Select all that applies. You have options. There are 5 options and you can select all that apply. Choose the correct answers. Okay, here the right answers are 2, 4 and 5. Question number 5. The nurse is administering an intermittent tube feeding to a client per an NG tube. The nurse has checked placement of the tube, checked for gastric residual, and aspirated 150 ml of gastric contents. Which of the following next action is most appropriate? Options are hold feeding and notify MD of gastric residual. 2. Proceed with the tube feeding. 3. Return the aspirated gastric content to the stomach and flush the tubing with 30 ml water. 4. Return 100 ml of aspirated gastric content to the stomach, followed by the tube feeding. Okay, the right answer is 1. Hold feeding and notify EMD of gastric residual. Question 6. The physician has ordered that a client with diabetes
insipidus
receive 50 micrograms of
desmopressin
acetate by oral tab twice daily. The tablets are labeled 0.2 mg per tablet. How many tablets will the nurse administer for each dose? Record your answer using a decimal number. Here your options are. Okay, you got the answer. The right answer is C, 0.25. Question number 7. Following surgical removal of an ovarian cyst, a client has not urinated in 4 hours and feels the urge to urinate but is unable to initiate urine flow. Which of the following should the nurse do initially to promote urination? You can choose as many related answers. You have options over there. Okay, The right answers are 1. Pour warm water over the client's perineum while she is on toilet. 2. Ask the client to blow bubbles through a straw into a glass of water while trying to urinate. Question 8. An adult client has instilled drops into the air to soften cerumen, and the nurse is to irrigate the ear to remove the cerumen. Which of the following statements are correct about ear irrigations? Select all that applies. We have 6 options. Okay, here are your right answers. The penis will be pulled up and back, allow fluid to drain out during the procedure, position client in sitting. Question 9. A client receiving chemotherapy for breast cancer stage 2 tells the nurse that she is considering complementary therapy to relieve her almost constant nausea and asks the nurse for advice. Which of the following complementary therapies is most likely to be safe and effective? Options are acupuncture, therapeutic touch, magnetic therapy, herbal therapies. Okay, the right answer is acupuncture. Question 10. The nurse asks a Hispanic immigrant to evaluate his pain on a scale of 1 to 10, and the client states his pain is level 1. However, the client looks distressed and is bent over and rubbing his stomach. Which of the following approaches by the nurse is most indicated? You have your options below. Okay, the right answer is 1. Use a different type of positioning to ascertain level pain.